Nothing good happens after 40 weeks. This may be something someone has said to you in the past. I myself have actually said this in certain clinical situations, so let's talk about it. This original comment is in regards to my personal decision to have a 39-week elective induction. As an OBGYN, I've seen a lot of things go a little awry at the end of pregnancy, so for me, the benefits of a 39-week elective induction greatly outweighed the risks, and so that was my personal decision. And that's where nothing good happens after 40 weeks has two components that are really important: the current clinical situation and the patient's preferences. So what I mean by clinical situation is, say that a patient comes to L&D triage at like 40 weeks in a couple days and they say, I don't really feel my baby move anymore. Baby looks fine on the monitor, but for some reason the patient's not feeling their baby move, and now we're kind of discussing what do we want to do next. Their baby is fully developed, but there is a concern. And so in those situations, nothing good happens after 40 weeks kind of makes sense because there's a concern. Baby's fully developed, so after a risk and benefits discussion, it might be best to work towards an induction or a C-section if clinically indicated. But I want to be very clear that this little statement should not apply to all people, because for some people, there are a lot of benefits to going over 40 weeks. For the patients who really desire spontaneous labor and have no clinical concerns, going over 40 weeks has a benefit to them. By continuing their pregnancy, if there are no clinical concerns, they may be able to have that unmedicated spontaneous labor they're really desiring, and for them, something good is happening after 40 weeks. For me, my personal preferences were not to have spontaneous labor. I wanted an induction. And so for me, nothing good happens over 40 weeks, but it may not apply to you.